So, I thought we were going in the order received here, but we're not. So I have to, so I'm Karen Nikolai with Hennepin County, and I have to admit that I walked out the door and left my, my notes that I had written on the actual printer. So as Larry was talking, I was scribbling things going, darn it. So mine's probably going to be a bit shorter than the other two. So the first question is why use health impact assessment to ensure equitable outcomes? And I think there just are a ton of reasons. And Larry mentioned the environmental process, which we call the environmental impact statement on big projects. And that's a very similar process. But the only way that it gets into any form of human health is really environmental justice. And that was added during the Clinton administration. So environmental impacts actually started with a Republican president. They started under President Nixon, which it might be, that's a little factoid for you. And then really the environmental justice was added about 20 or so years ago. But it still didn't get at human health. And so in Europe, they've been using HIAs. And in the US, we're just kind of really starting to get into them. So I think if you're really working on something, on a process, and you're trying to get involved in that process that maybe another group is working on, if you're looking at a policy or a project, and you really want to get involved and you really want to be able to be articulate about it, a health impact assessment is a good way to go. So it's really a thorough process. It provides a good, consistent framework. You'll find that there are health impact assessments that are, you can do a quick and dirty one, and that's just kind of where you're gathering data that you find maybe on the internet or through journals, that kind of thing, and then, which I've done one of those. And then I was involved in the Central Corridor one. I was on the Technical Advisory Committee, and then for Bottineau, hired somebody to lead the process on that and worked with her. So it really brings people together, I think, in focusing on human health. And as Larry was talking about, the broad definition of health. So I just think that they can really bring people together, policy people, technical people, and then community members around a similar framework and the same language about the project they're working on. So I really think they can be really valuable. And my background is public health and urban and regional planning. So I firmly believe that all policy is health policy. I'm going to say that again. All policy is health policy. It is so important. I think, you know, we still develop and our elected officials adopt policies that have health ramifications that we haven't even thought of. And so health impact assessment is a good way to do that. So our project is the Bottineau Transitway. How many of you have even heard of Bottineau? Okay, so some of you. So on the sheets that I provided you, you can look at this sheet. It includes the Bottineau stations, and Larry has it up there. This is actually the life expectancy by census tract along the Bottineau Transitway. And as you can see, the darker colors mean shorter life expectancy. So we're building a transitway. And what does a transitway have to do with health? Well, it has a lot of things to do with health. And this kind of gets at where some of the concentrations of poverty are. Along Bottineau, only 24% of the people live in poverty, according to the federal poverty rate, within a half a mile of the Bottineau corridor. I mean, so that's huge. And in some areas, 40 to 50% of people don't own a car. So kind of our story on Bottineau is this transitway was happening. Hennepin County was already working on the environmental impact statement. And Joe Gladkey, our engineer, our transit manager, said, hey, Karen, we really want to look at health. And I said, well, that's great. I do, too. And so we ended up applying to the Pew Charitable Trust and getting funded to do our HIA. And so then through that process, let me just say that an environmental impact statement being a federal process, that was funded, and that cost about $2 million. Our health impact assessment was funded at $125,000. So it's just a significant difference. But a health impact or an environmental impact statement just does all kinds of forecasting and everything. And ours, we really worked as cheaply as we could. So we decided to add health, and I ended up being able to hire Crystal Meislack. If any of you met Crystal, she used to work at Rainbow Research. She's really just fantastic. And she did a bunch of stakeholder assessments and got people together and said, what do you want to look at? And we ended up with an advisory committee. And you can see in the summary that we had certain recommendations. And I got to tell you that actually access to healthy food didn't rise to the top in terms of data. When Crystal was looking at data, North Minneapolis and a lot of the areas, they're called a food desert, meaning that there's not good access to food, but it wasn't that the Transitway was really going to help solve that problem necessarily. But I have to say the steering committee felt so strongly about it that we ended up including it. So, so we ended up with some very good findings that, again, I have to look because I don't have my notes. Sorry, guys. So physical activity was a really big deal. People who take transit tend to get their physical activity without even trying. And the Centers for Disease Control recommends 30 minutes a day. By taking transit alone, the average person walking to and from and just kind of all the extra steps you do, get 20 minutes without even trying. And then the extra 10 minutes just happens for most people. So it's really easy. Access to employment. Bottineau will connect to Target Field, and then it'll go all the way down to Southwest in Eden Prairie and along Hiawatha into the Green Line. And if you've heard anything about Southwest, that's the jobs corridor. So people will be able to go all the way from way up in Brooklyn Park all the way down to Eden Prairie, and there just are so many jobs. So it'll make a huge difference connecting people. And remember, 24% of people along Bottineau are in poverty. So it'll make a huge difference. So just all kinds of things. And one of the other things I want to point out is housing and transportation are two of the most expensive costs. The cost of owning a car is over $9,000 a year now. So it's super expensive. And then that plus transportation just becomes, that plus housing, sorry, becomes really unaffordable for a lot of people. So in our HIA, we found that this will really help decrease costs. So we ended up with all these recommendations, and one of them said that really if we kept on focusing on health and if we looked at community engagement and really tried to do community engagement with communities of color and underrepresented communities, that we would get a long way toward incorporating health. And so that's what we did. So we applied for more funding, and we ended up partnering with Nexus, and it's been just the best partnership that I could imagine. And we collaborate with Larry, and we work with other people in the room here. And so Larry has really led the way on a lot of the community engagement that we've done. And we have a cohort that works together, and they work with us at Hennepin, they work with Nexus, they work within their communities. Some of them are neighborhood associations, like Harrison Neighborhood Association and Heritage Park. Some of them are faith-based organizations, like Masjid an-Nur and Redeemer Center for Life. They're really involved. And some of them are communities, cultural communities, like Clues or Lao Assistance Center. So, and again, I guess I have to give most of the credit to Larry, the work that he's done. With everything that we've done, we're really making a difference in terms of getting that impact. And that's all going into how we're planning our stations, what's going to be near the stations, and who the stations will serve. And so we're trying to make good bike routes to the station, make it so people can walk to the station, and so that there's housing that works for low-income people, for middle-income people, and for high-income people. So really so that the stations really work. And so I don't know. So that's kind of our story, I think. I just want to point out the other pieces. So this is actually a map. I thought you'd be interested in it. It's the whole of Hennepin County rather than just the Bottineau Transitway. And it shows our communities where either the populations in those census tracts, so not necessarily the whole city, but in those areas, have at least 20% of people at or below 200% of poverty level. And we use that in public health a lot because if you're at 200%, you can't afford, you often already have to make decisions between medication and food or those kinds of things. So I thought you'd appreciate that. And then it also shows where there are a lot of communities of color. And you can just see along where the Bottineau Transitway is, if you match that and you match the life expectancy you can just see that everything really matches up. So we're really excited that we're able to connect all those. And then Larry pretty much talked about this, but the other piece is considering what creates health. And these are things, a lot of these things are what we looked at in our health impact assessment. So I just wanted to give you that. And then I handed you, and I apologize again that I didn't have copies for everyone, I handed you the summary of our HIA, and here's our full one. It's huge. The nice thing about this is it's all online, and we have it online in Spanish, Somali, Hmong, and Laotian. Not this full report, but the summary. The full report is pretty technical, but the way that Crystal laid it out too, you can click on it and jump to the different sections of the report, so it's really easy to use. So with that, I will sit down. Thanks.
All right, who's next?